Hi, I'm Teresa, owner of T3 Fit, and you're listening to the T3 Fit podcast, where scoliosis warriors and professionals come together. Here we talk about our scoliosis journeys and the emotional components it takes on from being a parent to being diagnosed with scoliosis and sometimes leading to surgery. It's a place where professionals share their expertise of treatments, from physical therapy to surgery, and so much more. So let's get started. Hey everybody, welcome to the T3 Fit Scoliosis podcast. On today's episode, we have Abby Hilton from Columbia, South Carolina. She is a physical therapist who specializes in scoliosis. She is here to talk with us today about her journey of scoliosis, being a physical therapist, and how she came across this journey and where it started, where it has brought her to today, and why she started it. So Abby, it's your story, and I'd like to welcome you to the show.
Thank you, Teresa. Thank you so much for having me. I am so thrilled. I love all things scoliosis and can always keep talking about that and being a PT. So thank you so much for that opportunity. So I have been a physical therapist now for 14 years. I graduated from the Medical University of South Carolina in Charleston, South Carolina in 2010. And I knew when I was in PT school that I wanted to specialize in something. You know, in PT school, you're taught to be a general therapist, and I'm a perfectionist. In my opinion, you cannot be good at everything. So I'm like, I want to find an area that I know a lot about, that I can really make an impact. So my career path wasn't straightforward to ortho. Exactly. I started out working at a level 1 trauma center here in Columbia.
Okay.
And was on the trauma team. So saw a lot of crazy things, really expanded my medical knowledge, which was great. And still, I use a lot of that knowledge today that I learned in my first few years of work. But then I transitioned. I worked 2 jobs at one time. So while I was on the trauma team at this hospital, I took a part-time job as a home health pediatric physical therapist. So I would leave the hospital and then go and see 1 or 2 kids every evening. And then after being at the hospital for about 3.5 years, working both jobs for about 2.5 years, I left the hospital in 2013 and transitioned to fully doing home health pediatrics. So expanded my knowledge a ton about kids, but I realized with home health, I was very by myself. I mean, I didn't, of course, have a place to come with coworker, to come to where I had coworkers, and where I did work on a team. So I would work with an occupational therapist, a speech therapist to work on this child's overall plan of care. I didn't really have anyone to bounce PT ideas off of, or I didn't feel like it was interdisciplinary of the sort to help me grow in my career.
Okay.
So I met a dear friend. I joined the Junior League of Columbia, and I met a friend who worked in outpatient pediatrics. And so she said, hey, we're hiring at my office, so you should come, which is currently where I am still employed. So in 2016, I transitioned to outpatient orthopedic peds. And it's funny because I always said in grad school, I don't like the outpatient orthopedic world. And yet here, this is where I have landed, which is great. So my caseload when I started here we saw birth to 10 years of age. So I saw a variety of ortho diagnoses, but I started treating kids who had scoliosis, and I liked the population. And some kids, I was able to treat it really well, knock it out of the park, and fix, quote unquote, fix them, but really reduce their curve, make them stronger. But then some kids, their curve would get a little worse, or they weren't getting better. And in my eyes, I didn't feel like I was really treating them. And I kept thinking, I am missing something. There has got to be so much more to how to treat the spine and your trunk as a whole as a small child, that I am missing something. There's no way I learned all that I could have in grad school. So I kept doing some research on my own, and everything led me to treating the spine from a 3D standpoint,
Hmm.
basically looking at the Schroth technique and leading kind of how that's transformed into today, which I eventually was led to BSPTS,
Hmm.
which is, based out of Spain. But again, based off of Schroth from many,
Okay.
many, many years ago in Germany.
Right.
So I did an initial course with Amy Feely up in Boston, just as like an intro course, I think maybe August 2018. And I decided then after like just 3 days, I was like, I've just only skimmed the top of the scoliosis world. Like, this is so interesting to me. I want to hone in more on this.
Hmm.
So, come to find out, I did more digging around and realized that our team of doctors here would send any child that had a high curve or really even like 20 degrees and above. They were sending all those kids to either Atlanta, Charlotte, Greenville, Charleston, anywhere but Columbia. And I'm like, well, hey, this is a huge patient population that we're missing out on here when our docs are sending them some out of state to get this care that we're not offering.
Hmm.
So I made a proposal to my manager, pitched it to him and said, hey, would y'all pay for me to get certified in level 1 of BSPTS technique? And so I was supposed to be certified in March 2020, but then the world shut down because of COVID. So then that did not happen until 2021.
Okay.
And unbeknownst to me, another coworker of mine who's technically in our youth department at another clinic, she was also very interested in scoliosis and figuring out how to treat this population better, and
Hmm.
basically went to management as well and was like, hey, I want to be certified in this. So we have built this scoliosis program since 2021. We were both certified in level 1. So now we have both gone to level 2. So we have basically started this program in 2021 and it has blown up, which is wonderful. So our
That's
doctors now
great.
send
Yeah.
all of our patients to us, to one of our clinics, and we are overrun with referrals, which I'm so glad. But one thing that we have realized is that some kids are just diagnosed so late.
Yeah.
And so I'm thinking, like, who has had their eyes or not had their eyes on these kids? Which then led Jen, my coworker, and I to kind of delve more into the fact that South Carolina is one of the I think maybe there's 20 something states that no longer do screenings in schools. And I don't know why we got rid of that. When I was growing up in like 80s, 90s, we had school
Yeah.
screenings for scoliosis, and that is no longer a thing. So it is in our program goals to start school screenings again in South
Hmm.
Carolina somehow, just to get that going, because I think, there's a large part of our population that sometimes when they go to school, a public school, that is like where they are going to get some health care. I mean, just like
Hmm.
your vision screen, your hearing screen,
Yeah.
because maybe they don't have a family that takes them regularly to the pediatrician where you would check for scoliosis, at these like pivotal times during growth. So, anyways, that is kind of a side note, but we're also working on getting school screenings back in South Carolina just because one thing that we have seen is that kids are diagnosed so late, and that it's hard to, I mean, you can't reverse like a
Yeah.
45-degree curve.
No.
We can work with it, to try to
Yeah.
avoid surgery. But this is my office. I'm here all day, every day, Monday through
Right.
Thursday. And I see a lot of kids. So my main caseload now is 9 years old to 17, 18.
Hmm.
And the majority of my caseload comes to me to avoid surgery. So
Okay.
I don't get a ton of post-ops. Talking with you just briefly a few minutes ago about movement limitations and what I know about movement limitations, I do think we need to see more of our post-ops.
Yeah.
I think that
Yeah.
needs to be a protocol. So that's
Yeah.
another thing.
It's interesting because when you were saying they stopped doing in school, and I was just thinking about my daughter when she was in high school and even junior high school. I don't remember them doing it with her.
I think families are, when they have a child that's diagnosed with scoliosis, it's kind of ensues some panic. And then you go to Google,
Hmm.
which is not the best thing to do. And then you
Nope.
see like the worst of the worst. And so it's, I feel like we meet families from like a PT perspective. A lot of
Yeah.
families, it's like they're not a great time where it's like, well, we, are going through growth spurts. We are doing sports, but we're also like trying to keep them like not let them miss any school, but we now need to like do this therapy. And so
Yeah.
it can just be a lot of just a time of panic for a lot of people, which
It's
you don't
very,
ever
it's,
want
yeah,
it to be that way.
it's very overwhelming. And as you said, we talked about this, before. And like when my daughter was diagnosed, she had to do it. I had to pull her out of school twice a week early to go to the
Mhm.
Schroth specialist. And then I had told the Schroth specialist, and fortunately, I lived in Germany, so I understood some of the language because it's
Sure.
Katharina Schroth.
Mhm.
And I told the specialist, I said, I want photocopies of every single exercise that you're doing. And I
Yeah,
want you to cue me doing them. And then I did it with her for 5 days a week for 2 years.
that's awesome.
So
And
it's
that's
it's
intense.
it's intense. And she had days where she was like, I don't want to do it. And then she would say,
Sure.
Mama, I want to have surgery. And I was like, no, you don't.
No, you don't. You
Which
don't.
is what we talked about before, because there's the whole space of, okay, you have clients and patients who post-op and they don't know how to move
Right.
because nobody talks about that. And
Sure.
then like you physically don't know how to move, but then you're mentally like, what just happened?
Right.
And that is really, that's the hardest part, I
Sure.
think,
Yes.
just to adjust to that. But it's, yeah, like I said to you, I said that, that'll make me cry. Um,
Absolutely.
but
And
that's
it's
my own story.
right. It's also like the magnitude of having a child understand that this is how they're going to be, not just for a year, not just for 2 years, but
Yeah.
like for the duration.
Yeah.
And I think that's very hard to comprehend.
So how do you, when you have fused or non, how do you have that conversation with your patients, with your clients?
So I don't ever want a family to come in here and me be like that I'm dropping a million bombs on them. So I'd
Hmm.
first start the conversation with like, hey, tell me what like the doctor talked with you about and what
Hmm.
is their plan from already looking at you from where you are in growth, the degree of your curve, what has the doctor said to you? And by and large, most families have started already with a brace and they'll say,
Okay.
we're going to do bracing and we're going to try to stay out of the surgical range. And so I kind of let the conversation hang out there. And then I move into what is actually happening in the spine with rotation. And so I show them like with a noodle, what is really
Hmm.
happening and like how from a PT standpoint, we are going to target this. And I'm all into visual cues. So I have not cues, but like a visual aid. So I have a
Hmm.
lot of I have some drawings of a spine of different curves, and I
Hmm.
kind of explain like if your spine is in these different blocks, this is what we're trying to do, and this is what we're putting back together. We're trying to put your spine and the blocks of your
Rebuild the
spine.
blocks. Yeah.
Yes. So I talk to them about that. Then I take them into two very simple exercises that are basically a precursor as to the elongation that we're trying to get with the
Hmm.
spine, the
Hmm.
derotation. And from there, once I feel like the patient and the parent have like a good understanding, like, oh, well, this is what's going on, this is how we're going to fix it. Then I say, I tell the families that my most successful patients are ones that come see me on a regular basis and do these exercises at home at least 5 days a week. So we
Hmm.
start there small and I give them, their PT homework. And then I just say, like, we're going to build on this each time you come in. And I mean, I put the kid on the spot and I'm like, do you think you can do this? I mean, let's just, again, we're starting small, but we're trying to avoid, like, our end goal is you not having rods in your back because
Yeah.
that's going to change your life forever, of course.
Permanently.
Yes.
Yeah.
Um, and I will say, knock on wood, and this is not to toot my own horn, I have good buy-in with a lot of my families, and I tell my all my families, most of them have my cell phone number, and I tell them like, I'm here for you. You know, like you don't always have a direct line to your orthopedist, but I feel like from a PT standpoint, I can be their direct point of contact. So I tell them like, hey, if you get home and you are stressing about Scoli and you have questions, call me, text me, we'll chat about it. But I also use that communication to make sure that my kids are set up well with their correct posture with when
Mhm.
they're doing exercises at home.
Yeah.
So I try to like tell my families whether this be the right or wrong approach, but I, tell them like we're on this journey together. And if I'm like investing a ton of like my time and energy into them, then I want them to do the same, like I'm saying this to the kid, and because I want them to continue sports, and I don't want them to have back pain for the rest of their lives. And I want them to be able to move, when they're 20, 30, 40, 50 years
Yeah.
old. So
You're give you're giving them the building blocks for life lessons,
right.
and
Um,
that's huge.
so I do love this population, and I've found my scoliosis population is so different than just a general pediatric ortho population
Mhm.
because again, most of the kids want to and the families want to be successful, and so they come to therapy. They do what they're supposed to at home, which is so refreshing because you don't always get that in the PT world. Not everyone does what they're
It's
supposed to
true.
do. And I tell my
Oh,
kids, I don't have a magic wand. I wish I did, but like you can't come in here one time a week and I can't fix you like that.
yeah.
Um, and so every time my kids come in to therapy, I say, how's your brace going? How are your exercises? And for the most part, they're pretty truthful. And if they try to, not be truthful, the mom or dad's like, they're lying right now. They
Yeah.
haven't done their exercises.
But this is such an important point, because you are, there's the saying, it takes a village, right?
Sure.
And you're part of that village for that family.
I've had some kids, and this happens, of course, every like few months that we have most of our session is like a hard session where I'm sitting on the mat with them and we're talking about this conversation will come after the kid is just not doing anything at home, but we'll talk about like, hey, these are the things you're going to struggle with when you're 30 years old. And so
Mhm.
that's what we're trying to avoid. And so we do have some of those hard conversations. Like I will of course have like the parent in on it and
Yeah.
everything, but I think it's so important for anyone for any child or adolescent to
Mhm.
understand the repercussions down the line, and what we're
Yeah.
trying to avoid. And I'm sure I've ruffled some kids' feathers, but most kids seem to take it and they're like, okay, this was helpful,
Yeah. But you
talking through
you
it.
you also you have to be real about it.
Sure. Right. No. And I don't think it's okay to sugarcoat anything. I didn't grow up that way. And that's not really
Right
how.
right there with you. Right there with you. When share so I always like to ask people, do you have a story that is like your win of all wins and just keeps your heart driven to still do what you do? And then do you have a story that hurts your heart?
I do have a few of some good wins. So
Okay.
when I first started, when we were starting this program, I had a child come to me. She was starting her senior year in high school, and she had been seen by some of our youth therapists within our clinic, but they're not scoliosis specialists or anything. And they sent her up to me, and they said, "Well, she has 3 different curves. We don't know what to do with her. Can you
Okay.
help fix her?" And so I'm getting to know her the first time I see her, and she is in theater, but also plays the flute and sings. And she said, you know what? Like, one of the biggest things in my life that I can no longer do is sing 2 songs back to back. And she's like, no one can tell me why. And I was like, I can tell you why, or have a good guess here. We talked about our lungs being behind our ribs. And when you have this rotation, you're going to have changes in your ribs. And so your ribs are going to be closer together on one side, further apart on the other side. And the side they're closer together on, your lung is not going to really expand as much. So you're not going to get the um, airflow that you need through your lungs, which directly impacts your singing.
Yeah.
So we worked, I mean, probably for 9 to 12 months, and just on elongating her body, derotating. And I will say she didn't have surgery, but her curve degrees did not change a ton, but we were able to get her to a point where she was just more expanded in areas that she was collapsed. And before she graduated high school, she was like, Miss Abby, I can now sing 2 songs back to back again. And I'm like, this is the best news ever.
Yeah, that's a
I mean,
win-win.
do you still have a curve? Yes, but like it has impacted you so in a positive light so that you are able to get back to what you love doing. And so that was very exciting for me.
That's huge.
One of my, a case that I struggle with, and I will say I still see this child, and it is still like to be determined if she's going to have surgery. But I started with this patient 3 years ago. And as much as I have talked with her and mom about exercises and brace wear, it's never their top priority. And I will say it starts with a parent. And whereas this family is great, they put plenty of other things, they prioritize many other things in life above this child's physical well-being, in my opinion, from my perspective. So it's always more important for them to take like a family trip, like 2 weeks to Canada or 2 weeks to the Grand Cayman, kind of just go all these places, never take our brace. We'll stay out of therapy for 2 months in the summer, basically, because they're traveling, don't do exercises when they're traveling. And then even at school, when it's the school year, things are more important, like going to like our honors art class are more important after school, rather than like maybe skipping this special art situation after school to come to therapy. So there's never any give with them. It's kind of always been, well, where does therapy just fit in, basically? And I have seen through all of her growth spurts, her curve has gotten worse and worse and worse. And she now has, I mean, a 2.5 centimeter trunk shift. Her body awareness isn't great, but I feel like I've put so much time and energy into trying to fix her back and give her the tools to help herself. And I feel like it's kind of fallen on deaf ears. And I'm afraid she's going to end up in surgery, which is very sad for a lot of different reasons, from many perspectives. But I don't know. I look at this and I beat myself up and I'm like, where did I go wrong? Talking to her about things, maybe I didn't give her enough ideas of how to do exercises when she's like out of town, or maybe I didn't like tell her like enough. I didn't like, emphasize enough that like, you need to wear your brace as much as possible. I don't know. So I go back and forth with like how I could have handled it better. And she may not have surgery, but she is like right there at where our surgeons, are 55,
where it
57.
becomes a conversation. Yeah.
And that's hard. And it's interesting when her family comes in, it's almost like they don't realize like, hey, we have been trying to avoid surgery. This is going to be so impactful on your life in a negative way if you have surgery. But it almost is just kind of, I don't know, aloof is not the right word, because she comes from a very smart, very educated, well-traveled family. But it's almost like everything else in life is a lot more important than your physical well-being.
You gave them
which
the
is hard
tools.
for me.
It's hard, but you gave them the tools, and it's their choice to take advantage of utilizing those tools or not.
Sure. I appreciate you saying that. The other kids I do struggle with, and I've only had maybe 2 or 3, are the ones that have come to me needing surgery. So I've known from the get-go that I couldn't keep them away from it because it's already scheduled, basically, like 3 months down the line. But it's hurt my heart for these kids that are these teenage girls that, I mean, you already deal with body image
Yeah.
issues at, the middle school, high school age. And I hate it for them that I'm like, this is going to just rock your world. And, you know, those are the families, those 2, 3 families that I've had come in here, and they're just like blindsided with everything. And that just hurts my heart. Cause again, I'm
Yeah.
like,
That was
who's,
me.
I mean, and I don't know, like, I don't know how you like mentally deal with that as a child going through it, or even like how a parent, you know what I mean? Like,
You
I
do the
can
best you
imagine like,
can.
right, yes,
Do your research. Right.
having that foundation is
Right.
amazing.
I was just gonna say, like, and that's the gift that you give, right?
Sure,
It's not, you don't, you specifically are not with your patients necessarily forever, but you
right,
give them the foundation and then they can build on the blocks to help
sure.
decrease the curves. And that's huge.
And that's just the
So,
brass tacks of it, it's
right.
hard, but this is the hardest this will be is still easier than you having surgery, you
Hmm.
know? And I think
Yep.
getting kids and families to understand that is a huge hurdle. I feel like once they are understanding of why we're doing all these things, they're like, okay, I get it. And their compliance is better, which is
Yeah.
helpful. But making a point about insurance, that is something I struggle with almost every single week because of the red tape with insurance. And it
Hmm.
is so frustrating as a healthcare provider to, write in a note and say, like, these are the reasons why this patient needs continued therapy. And then, you get the authorization was not approved through insurance. And it's, sometimes I want to get on the phone with these insurance people and be like, do you understand this kid is
Yeah.
like could have surgery? And do you want to pay for surgery? No, you don't want to cover
Yeah.
a spinal fusion. You probably would rather pay for PT. But that being said, insurance is like a huge hurdle, I feel like, in my everyday life. And, I have plenty of we offer a self-pay option at our clinic. So it's at like a reduced hourly rate, but of
Hmm.
course, like the money pay is not going towards your deductible. And we have plenty of families that do that because some families are like, no, we're still going to come either once a week or twice a week, whatever is recommended, but just that insurance piece is a hurdle for a lot of families, which is unfortunate because insurance is supposed to be there to help you. And then it's like you pay for it and
Yeah.
then it
Yeah.
doesn't. It's a
You
mess.
literally pay, you pay the price.
Yes,
You literally pay the price. Tell me, you have patients that have also had surgery.
I do. I mean, a few, not the majority of
Okay.
my caseload is pre-op,
Okay.
or trying to avoid surgery. But I've had plenty that have had surgery. And I've
So,
had some that are initially out, but more that have actually come to me a few years out with like scapular immobility that has caused pain and that kind of
okay.
stuff.
That's what I was just going to ask you. So what is something that you would work with somebody who has a fusion? Like, what are some of the things that you would do?
Two of the biggest things of my kids that have had surgery that I've noticed, their limitations afterwards. One is they will complain of their upper extremity range of motion. And I've realized that that's from the scapula basically being stuck and not moving, having that normal glenohumeral joint rhythm that your scapula has when
Hmm.
your arm moves. So with those patients, I've done a lot of scapular mobs. We've done like strengthening of just like the scapular stabilizer muscles
Hmm.
and worked with them on just range of motion with, shoulder, upper extremity range of motion in a gravity eliminated position. We'll start there and then I'll do assisted movement with them and then um, combine that with, of course, like stretching and strengthening because if things are tight, things are weak.
Hmm.
That's when you're going to have pain, when those two play off of each other. So addressing the scapula is something huge. And then another thing, yes, people are technically elongated, I guess when they have rods in their back, but I've realized that my kids that have come after a fusion are weaker everywhere else. And it's almost like their body just um, conforms like around the rods. And so
Hmm.
their core muscles are not great. And so where we should have elongation everywhere, it's like we have still some compression places, because yes, they're straight back here, but they're not using the rest of their muscles as they should.
Okay.
So encouraging them to have a better posture, but using their muscles to hold their trunk up,
Hmm.
appropriately, and stretching and strengthening within their limitations. I've realized that also will take away the pain that they come and complain of.
Find your, quote unquote core strengths.
Mhm.
It can be more challenging for us than for somebody who's not fused.
Absolutely. I've noticed in my patients that have had a fusion, I work so much on their soft tissue. And
Mhm.
so I've started hitting more of the soft tissue in my treatment of someone who has not been fused. But it is amazing just the changes in the body from just soft tissue, it changes from someone who is not fused and then someone who is. And then just, I think about the work that my patients who've been fused, the work that they have to go through to take a big deep breath when
Mhm.
their soft tissue, they're so limited in soft tissue and their mobility, it just makes their lives harder in everything they do. And
Yeah.
so them being taught, just almost like retaught body mechanics, is so important to this population as well.
And it's the body mechanics that can be so small,
Right.
but so big.
Yes. When I was going through my level 2 training with Amy Spieley up in Boston, um, I would get to where I would say like, "Okay, how does this feel now? How to compare to this?" She's like, "Don't ask your patient that." And I'm like, "Okay." So I've learned to like use my hands a lot more
Mhm.
and not talk as much, but I can see and feel the differences like in my patient when they understand like how to get expansion just from like a tactile cue from mine, not so much me being like, how does this feel compared to how
Yeah.
it was feeling? And that has been a learning curve for me. But it's it's amazing from when I started the scoliosis journey how much I have learned. And I remember thinking after my first course, I shouldn't have even been treating scoliosis when I came out of PT school because I feel like I'm missing so much,
Yeah.
which
And
is
that's huge that you say that, because when you become a physical therapist, they only give you like a very short segment of the spine.
and that's also unfortunate. Kids that I have come in here and they're like, well, we've been getting therapy, down the road with just like general PT for a year and our curve is getting worse. And I'm like, because
Yeah.
they don't, you're not taught how to treat it appropriately in PT school. And like, you can't be like, I mean, it's a specialty area. You're not, you
Right.
know, physicians are not like taught to be a OBGYN in med school. That's not how the world works.
Yeah.
Or you'd be in school for like 25 years, which is also not feasible. Um, but another thing too, I've had people that have come to me and have gotten care from only a chiropractor and their curve has gotten worse. And I'm just like, oh my goodness. I mean, everyone in healthcare, I feel like, has the end goal of a patient succeeding in whatever their case is in life and doing well. So I feel like the least we can do as healthcare providers is help our patients get to the best course of treatment. If what
Right.
is, going on currently not helping, then help them find what works best for them and their
Right.
body and their compliance.
Yeah. And that should be, I think, the goal of anybody.
Absolutely.
Um, but I really applaud you for saying that, physical therapy, when you were when you were studying to become a physical therapist, and then you were like, I shouldn't have even been doing this at that time.
Mhm.
That's huge accountability. My heart and like my head is applauding you in
Thank
magnitude.
you.
Is there anything that you would like to share today that you haven't already expressed, that
Oh,
you would like to
goodness.
tell people on the
Um,
podcast?
let's see. The biggest thing is early detection and um, getting care, no matter what, curve degree you have, even if it's 9 degrees. I mean, you have a young child and they are showing some sort of spinal curvature, don't dismiss it, at least have them checked out by someone, and, have regular posture follow-ups, even with just a small case, because those small cases, the large cases have to start somewhere. And the more I see so many scoli patients coming through my office, I always think, like, in the severe cases, like, if we had started sooner, they would not be in this position. And so to me, early detection is just huge. And June is Scoliosis Awareness Month. And so I will occasionally put stuff on social media or my stories about, in June, like, hey, go get looked at, like a posture assessment if your pediatrician isn't, kind of thing. But that's like probably like my biggest takeaway to just anyone, would be early detection is key to being successful in treating a spinal curvature.
On that note, I would like to thank you, Abby
Of
Hilton, for being a
course.
guest. You're welcome.
Yeah.
Thanks for giving us some time.
Thank you for
And
having me. I was so excited about this.
if anybody would like to reach out to Abby, you can find her on Instagram under Abbey Road 919.
Yes,
Abby,
that is
I
it.
would like to thank you for being a guest. And she's in Columbia, South Carolina.
Yes.
If you want to reach out to her in person, do you also do virtual?
I have, and I can't do it, I can't bill for it, but I have definitely done virtual things with patients after hours. I mean, it's not, we
Okay.
don't do telehealth that we did during COVID, but then my clinic
Okay.
has like moved away from that.
Okay. Okay.
So,
So if anybody has any questions, she's in Columbia, South Carolina, and you can reach out to her on Instagram under Abbey Road 919. Abby,
yes.
I'd like to thank you for being a guest on the show.
Thank you, Teresa, for having me. I greatly appreciate it. It's been a pleasure.